My name's Gillie Jenkinson. I'm a psychotherapist in the UK, and we have a different system in the UK. So we have 2 or 3 accrediting, maybe a few more, but accrediting organisations. We're not licensed with the state or anything like that. So because it's not officially licensed, these different organisations were set up. And I'm accredited with 2 of those organisations, and we have a code of ethics, and I feel very passionately about being under that banner so that clients have the power to report if they're concerned about anything. But I'm obviously very careful with my clients, but I think it's very important to do that. And I am a former cult member, so I was in a Bible-based group in the 1970s, so a very long time ago. And when my husband and I, Tony, left, we realised that there was virtually nothing available for former cult members, really worldwide, but also in the UK. And so it's a long story, our exiting and etc. But I decided I would train as a counsellor in order to help other former members. But initially I knew that it was going to be vital for me to get my own therapy, to actually train professionally, and to learn to work with other types of clients. And I think that was always really essential. So I worked at a rape crisis centre for 11 years. I worked for a mental health charity in the UK called Mind, and with a bereavement charity, and gained a kind of overarching sort of experience of different mental health issues. And my first training was actually a diploma in pastoral counselling. And that was really helpful because it introduced me to kind of secular counselling, which I'd been only exposed to kind of Christian Bible-based counselling before. But it also helped me to work with spiritual issues. Sometimes that puts people off coming to see me. They think I'm going to push a Christian faith because of that, but that isn't what it was about. But it was a very helpful thing, and I can therefore work with sort of Bible-based issues, Bible, the loaded language, or the sort of difficult issues that can arise from that. Then I did a master's in Gestalt psychotherapy, which I learnt later had quite a lot of what we would call dodgy issues in the background. Gestalt has kind of a mixed history. Fritz Perls, who created Gestalt, was, could be called a bit of a guru. So that was something I had to really think through and look through. But that was good. I could weigh up what do I find helpful within Gestalt and what do I want to just get rid of. And then I just 3 weeks ago, or 2 weeks ago, I can't keep track of time, actually submitted my doctoral thesis. Which was quite some marathon, I have to say, and I'm still a little traumatised by it and kind of shaken up by the whole thing. And I investigated for my master's and for my PhD what helps former cult members recover from an abusive cult experience. So I was originally going to talk about it in this session, but I need to have my examination, and so I'm not ready to kind of talk about it. I'm going to do that next year. But a lot of really interesting stuff came out of that, and, I hope to share that with you. So, but basically, in the meantime, and also from my master's research, I developed what I've called time away for post-cult counselling. Now, a lot of the way that this model of counselling is structured was based on the Wellspring thought reform model. So in 1999 I went to Wellspring. Paul Martin's wife Barb is here, and just embarrassed her. But I met Paul and Barb in 1999, and I had a 4-week internship at Wellspring, and the clients actually allowed me to sit in and shadow the sessions with the therapists, Paul and Ron Burks, who's here. Paul sadly passed away some years ago, as you probably realise. But he became my mentor, really, and a supervisor, and really, you know, kind of helped me, gave me the confidence as well to really kind of build my own practice, my own work, and it was just invaluable to me. And so I'm going to talk about the post-cult counselling, and I'm going to explain how I've structured it. There's a lot of thinking in the background, but I'm not going to go into all the details of it. It's a little complicated, and welcome. Come and have a seat. You're disrupting us. You're disrupting us. So, Wellspring Retreat and Resource Centre offered very often a 2-week residential resource and therapy for former cult members. So people would go and stay at this beautiful lodge in the countryside. They would have 2 weeks there. They would have 2 hours in the morning on the weekdays of therapy with one of the therapists, who would the same therapist throughout the whole of the 2 weeks. Then in the afternoon they would have, and I'm not sure exactly how it's modelled now, but they would have actual psychoeducational workshops for 2 or 3 hours in the afternoon. So they're both having the personal therapy and the psychoeducation about cults and how cults work. Okay, is that clear? And so, having been to Wellspring and actually looking at how the model worked, people living in the residential retreat centre, so they're getting away from normal life, they're having time out, and in fact in that setting they had a residential coordinator who looked after them, cooked for them, you know, so the clients really could get away, could just concentrate on themselves and on their recovery basically. And it's kind of the first step of coming out. Then I hear that, you know, quite often people would go to other therapists then around the country. So, you know, it's not the whole story, that intervention, but it went a very, very long way. They also did a lot of empirical research. So, based on that model, initially we talked about setting up a centre in the UK, but this just didn't happen, and it's not going to happen with me at this stage, but maybe it'll happen. I think it might happen in France maybe. Yeah? Who knows? So the way that I decided to structure this and translate it into a private practice was to mix the psychoeducation with the psychotherapy or the counselling. And it's flexible, fluid, it depends on the individual, but I've worked with a number of ex-members now, and in this way, and I've worked with second generation and first generation, and the way that I actually have structured it, and again, this isn't set in stone, it's just how I've structured it, and sometimes it changes. And one of the considerations of that is self-care, you know, because it's extremely exhausting to do intensive work. So what happens is we live in a really beautiful area of England. I wish I'd brought a picture, but I haven't. There's a picture on my website, and I'll tell you about that later. And they come and stay in the area. They don't stay in my house with me. Okay, you'll be glad to hear. But they can stay in a bed and breakfast, a hotel, or now we have Airbnb. I've noticed there's some people, even in our tiny village in the middle of the English countryside, do that. So they make their own arrangements, come and stay in the area. And they come and see me in my home. I don't have a retreat centre. Some people say that I do, but actually I don't, just to make that clear. But I have a house that's that I've got a dedicated room to my therapy room. It's a lovely room. People usually love it. It's a big room. There's lots of space to move. I run a former members support group in the room as well, and there's a toilet close by, and you know it's very comfortable. And we work for probably up to 4 hours a day. So usually in 2-hour blocks. I find personally the 50-minute hour just doesn't, it just feels too restrictive. Although I will work for 60 minutes with local clients. So if someone's coming from a long way, they'll come and stay in the area and probably come and see me. Maybe I've worked with people for 2 weeks, sometimes for 5 days, sometimes a weekend. It depends on what they can afford, you know, because it's very expensive to live in a hotel or a bed and breakfast, whatever. So it's very flexible. It partly depends on their purse, you know, what they can afford, and it is tiring. It's very tiring. So I actually usually wouldn't see another client in that time. Occasionally I might be seeing some other clients. So that's a big consideration, because I decided to sort of dedicate myself more or less to doing this. So it's not very practical if you have a full lot of clients coming in and out, or you're teaching in a university or whatever. It's problematic in that respect, but it's definitely worth doing, and the feedback has been really good. And somebody asked me yesterday what kind of cults I had addressed, so I thought I'd tell you, because that's of interest to people here. And people come to me because they were in a cult. They're not coming to me, you know, they've already decided they were in a cult. Or sometimes they come and say, do you think it was a cult? Which is also really quite problematic to me, because I have a code of ethics. I think spirituality can be really life enhancing and a really positive side of life for some people, and so I can't be going, well, that's a cult, under that code of ethics. I just can't really approach it in that way. So just have to really work with them carefully on that. So it's much easier if they come in and say, I've been in a cult and I want to talk about it. You know, it cuts out that. It's difficult. But I've worked with Jehovah's Witnesses, Brahma Kumaris, Baha'i, Friends of Western Buddhism Order, FWBO, the Boston movement, or the London Church of Christ, or the International Church of Christ, children of God, spiritual abuse. So I do work with spiritual abuse as well, which isn't necessarily in the cult field. It's more on that continuum that people talk about. And one-on-one psychopathic abuse. So where there's a psychopathic husband, this model's actually worked really well with those people. And then some who've been in really other toxic kind of one-on-one cults where the partner is the spiritual leader or guru, but it's really that intense one-on-one, which is similar to psychopath abuse, but not quite the same. There's that spiritual element. Psychotherapy groups and new age psychotherapy, where it's going into kind of magical thinking and real control, and even use of LSD and drugs, endlessly using LSD in groups, which adds another aspect to it, the kind of whole drug use thing. And Buddhist one-on-one, where the Buddhist guru became really sadistic and persecutory. So that's, it's those kinds of groups. There are other groups I haven't worked with. And that's one of the issues of this model, is that what I decided was I would let the client tell me about the group rather than assuming I know about that group. So I thought I could hear your story or your story or your story, but actually it may not be the same story as that individual. So I think the model works very well with that. And I'm not going to go into all the details of what psychotherapists do, because a lot of you are therapists here and you know what you do, how you do the assessment and that kind of thing. I really wanted to kind of pull out the actual model. So if, like yesterday, Anthony, you were saying that there are so many SGAs from your Friedrichshof community, and I think there are so many former cult members just around, don't you? I really do, I really do. And there's a desperate need for more services and more provision and specialist provision, and there are certain people here who, do really specialise. You do, don't you, Rachel? And others, I don't know about others, but I think this is a model that can be replicated if somebody wants to really do that kind of specialist work. So, and it does, I think it works for first and second generation, but it does need tweaking, as we say. And I think there's a balance. I think first generation in this setting need psychoeducation. So they need to understand what is a cult, what happened to them, to really pull apart what was it that happened, to really make sense of it, understand it, and put that clearly in their minds. I think for second generation they also need that. But Cindy was talking yesterday about how there's this interweaving of the developmental issues, which, because they've grown up in the cult, the cult is part of their DNA, really, part of their whole development. And what Cindy's talk saying, how second generation have no sense of identity. That's what you were saying, isn't it?
Well, the cult is their identity.
Yeah, the cult. Yeah, there's no other sense of identity. So the cult is their identity. So kind of how do you unpick this, and how do you build up that sense of self? And one of the things that came out of my PhD research is building sense of self, and that's a whole massive big category of you know, what helps for, you need to build sense of self, and that's going to require a lot of creativity on the part of the therapist, a lot of support and a lot of help for SGAs. The other thing is that with first generation, it's really important to address the cult first. I really think it is. You know, it may be in occasional situations that first generation have a very traumatic childhood, and this has come clearly through my PhD research, my master's research, and what people say is that therapists have a tendency to go to childhood and family of origin issues, and then they blame. It ends up with that feeling of blaming the client, like somehow you're repeating your history. Maybe they are, but you know, maybe they're not. And also that it can undermine their foundations. That's such an important point. That if you, I mean, I'm preaching to the converted here, as it were. You know, it's not something that people here would do, I really don't think. But I think it's very important that the cult is addressed first. And then you have the issue of, well, where do you start? You know, because I think one of the problems with talking therapy is that the client could come in that room with you and, you know, you have to address the power imbalance. Like, I'm an older woman, I'm a white woman, I have to take into consideration all those power structures that are there just in society. Then as a counsellor, I'm an authority figure to the client. So actually giving them choices. I really have a bit of humour. I'm quite self-deprecating, if you understand that term. I can, like, you know, I don't know what they need. I don't know them, you know, but I do know about cults, and so I can bring that aspect and that light to shine onto their experience. So really being careful. So that's also the trauma therapy side of the issue, that, you know, counsellors need to understand about developmental issues, they need to understand about trauma, they need to understand about just counselling clients, and they need to understand about cults. So there's a lot to understand. And then I think you can, the counsellor can then be that kind of sounding board and that almost a mirror of, you know, well, maybe this is what's happening, maybe that's what's happening. But I think there's a danger for some clients of coming in and just splurging their story, and they can become very overwhelmed. And sometimes it's all like a dam, you know, I haven't told anyone and I just need to tell you. And this one guy came to see me, and he was highly traumatised. He'd been in a really toxic, very small group with a psychopathic, sadistic guy who was also a rapist, you know, with the men and the women, and it was a really very, very traumatic situation. And because he hadn't found anyone who really grasped both the trauma and the cult issue, because, you know, you could just deal with it as trauma, but actually it needed this other bit of a jigsaw to fit it together. And he just started telling me, and I could see him becoming more and more hyper-aroused, more and more overwhelmed and kind of shaking. And I said, okay, you know, we just need to slow this right down. And so there's that balance between telling someone what to do and what, you know, what you think, and but then kind of, and being too much, I'm the expert, I'm the therapist, I know, but also then actually containing it. And so what I often do with people is actually use the Wellspring thought reform model, and that was Dr. Paul Martin's he pulled that together and put it together in a sort of framework and created like these sheets with a definition of each of the 8 components of thought reform. If you don't know about it, you'll talk to me later or look online or talk to someone else here, because people here know about it. And so what we did with this guy is I just slowed it right down and I said, let's tell your story into the thought reform model so that you're moderating how you do it. So we looked at the theory, so loaded language, cliched language in the cult. Sometimes the Bible becomes loaded language. So start working with what was the language that restricted your thinking. Let's really talk about it. And then he told his story into that. And we went through all 8 components. It took 2 or 3 days, it just needs time. And that was it, actually, with him. He said, I for now, because he was so traumatised, and he had said to me, I want to start talking about the rape and the trauma, and I was like, not sure this is going to be the right thing to do. I could feel it in my own body, the kind of level of trauma, and I just said to him, maybe just let's slow this right down. And he agreed, he thought about it. And having done the thought reform, he emailed me and he said, I think it's time that I have a break now. Although we'd booked for him to come for longer, we just kept it, I think it was 3 days. He said, I feel like I've had a war going on in my head and that it's calmed right down. And so I think that's just one bit of the psychoeducational bit. I would probably talk about Cialdini's influence with other clients. I would talk about a whole lot of different areas. And it kind of depends on what the client brings up. So I teach clients about trauma. The woman called Janina Fisher has created this wonderful flip chart. I don't know if have you seen this? If you look on her website, janinafisher.com, she has this a flip chart which is a really simple description of how trauma works in the brain. Cindy, you were talking yesterday about it. It's absolutely fantastic because it's got pictures of like the trigger and then symptoms. So what she's saying is that very often trauma survivors have symptoms and not actual discrete memories. So you're living maybe, in depression or an eating disorder or hyper aroused, just really stressed, and actually not having any sense that there's a memory attached to that symptom. And that's just one bit of it. But I often use that flip chart with clients. So basically what I'm doing is I'm giving them tools to then go away with. And I give them a folder with different sections in it, and I print up the thought reform sheet. I'll copy it for them. Anything I've written down, I photocopy, give to them. And so they're being given information to take away. And I've had clients come from Australia and Europe and the UK, and it's really sweet kind of seeing how people will refer back to the sheets. And that's just a simple thing anybody could do if you don't already do it. To just, because it arms someone with information that then they don't need me, basically. That's the aim, is that they can move on. And then often I follow up with them. So it's time consuming, and then they'll end up maybe doing telephone, maybe doing Skype sessions. So I'm very experienced at telephone and Skype counselling, until they kind of work through. But what would be an ideal really would be to pass them on to other therapists. But there aren't really that many. In terms of myself, I always have supervision. So in the UK, we have to have supervision. And I have a really experienced supervisor. She's worked with me actually for 20 years now. So she knows about the work I do, which is really different. It's unusual, you know, it's not norm. And so it needs especially ethical care. And then there's people in ICSA who I will access. You know, 2 people I spoke to yesterday, I said, expert, yeah, can I call you if I need to? And I'm like, yeah, definitely. 3 people, actually. So, you know, always drawing on the resources and the networks that are there, and never feeling I should know or I do know, because there's always something else to learn. You do a PhD and you realise all the things you don't know, all the things you had to leave out, and it was already a book size, this thing, you know. So I think, is that clear? Can you get a clear picture of how I work? Yeah?
I do have a question.
Yes, have a question, speak up.
Is this a good time to ask a
Yes,
question?
yeah, because I need to finish very soon.
Okay.
10 minutes.
Okay. How does the Skype work for you with patients?
How does Skype
Yes,
work?
because I you know, distance is often a problem.
Yes.
So I try to Skype as little as possible because I find it hard.
Do you?
How does that work for you?
Yeah, I find it okay. I'm used to it. I think there is some difference, and I would prefer to Skype with someone who I've already met face to face.
Right.
But, say, for example, the person that came from Australia, there was no way I was going to do the assessment face to face before they came, and I needed to assess and speak to them and get to know them and begin to set up some kind of relationship and make that connection. So yeah, I think it's kind of practice, and maybe it's what suits some people and not others. And I have an agreement with my clients. It's kind of a contract, and I don't know what that's like in the US, but this is not a legal contract, but it's really detailed. So whoever comes to see me knows what they're getting and what my code of ethics is, what, you know, child protection, and if we use Skype, email, it's not 100% safe. You need to realise that, you know, apparently somebody bought Skype, was it Microsoft or Google or somebody, and they can publish anything that's spoken over Skype anywhere they like, and, you know, and they're not likely to, just as people aren't likely to, I don't know, you know, it's technology. So I actually made that really clear.
If you get the free Skype, they can do that. If you get business Skype, which actually costs, they're not allowed to do that.
Okay.
So as a therapist, I can use business Skype. I can't use Skype, the free one. I have
Well,
to pay.
that's helpful, thank you. I
That is
think
helpful, yeah.
that I need to do that too then.
Okay.
But, so, yeah. Does that answer your question? Yeah. I think it's great because then, you know, we have access and supervision with people in the US.
What I'm always a little bit afraid of, actually, with Skype is when you hit a trigger or you hit a really painful moment, or, you know, and then somebody's sitting there in New York and I'm in The Hague, and I'm like, okay, now what am I going to do? So that's a little bit my fear in the whole situation.
And I guess the thing would be to contract for that, to really spell it out beforehand. Is,
Yeah.
you know, how are you going to cope with that? Are you going to manage it? You know, will that be okay for you? And they can make that decision, and, you know, they may not realise what that
they're
means,
saying, no.
but I think if we spell it out as much as we can, or we may decide to send them to someone local. Yeah.
So I do a lot of Skype consulting and counselling, and I also have had those moments. So what I do now, and I mean it's not 100% of a safeguard, but what I do now is I start the first session by asking them who their who's part of their support system close to them. So that if they're having a hard time, then they can talk to X, Y, and Z people, you know. And people who are trustworthy, people who are going to be able to be patient with their feelings, you know, so that they know I know also that I'm not leaving them alone with their feelings.
Good, excellent, yeah. And I mean, that would be people who come for post-court counselling and time away. That's also a huge consideration of how are they going to manage with this intensive time away. So quite often they'll come with a friend or a family member. From Australia, the family member came and they met me and they spent a bit of time in the sessions to start with, although this was an adult, a very adult child. The family had lost them already. They needed to just make double sure. So I'm flexible about that, but say, you know, can we at some point get to just you and me, because then we can really start the work. Often people will stay maybe in a holiday cottage and bring a friend, and then they can walk on the hills and they can just get out, but have someone who's safe to be with. And I guess there are other issues. If someone's very triggered, you could ring me between a certain time, you know, if you need to contact me in between. But part of the assessment process is to see, and you can never be 100% sure, but to see, can they cope with this intensity? Are they actually far enough down the road that they're not going to really become overly dependent? And seeing it as a kind of a package of focused sort of psychoeducational mainly, even for second generation actually, because in maybe a week or 2 weeks, you can't do reparative psychotherapy. I think that needs to be the more weekly ongoing, and that would be, for second generation, would be easier, I think, to refer to a local trauma therapist once they really understand about the cult. Would you agree with that?
Oh, it's a mixed bag, because a lot of therapists that I've talked to don't understand the trauma of being an SGA, and they're like, well, why didn't you just leave the group? How is this a trauma? I don't see how that's connected. And so you have to be really careful who you refer to.
That is true. That's always true, isn't it?
Yes, yeah, but you could if they understood.
Yeah, it depends on their level of understanding.
Exactly.
So, any other questions? Yeah.
I don't know if you can answer in a short time, but are there different issues that you deal with people coming out of groups that have used LSD? Just because I feel like ayahuasca is growing, and that's kind of the group I came out of as well. And I think it's growing in the UK as well.
What's it called?
Oh, ayahuasca.
Bahai use that part.
And I'm just curious if the people leaving there, or it's still in their hat. I mean, I don't think they know that it's a tool that can be used to influence them.
I just had a new client who's been exposed to using LSD for years within a sort of therapy group. So I'm kind of just learning about that. And there are others who probably know a lot more about it than me, because I am learning about it. But I think in terms of altered states of consciousness, you know, and actually having parts of themselves available for the therapy, and there are a lot of issues. I think it's serious, and I think there are issues.
Well, I think for me initially, because it's such a profound experience, I didn't know what was real or not. And so it was, you know, thank God I'm grounded now, but I mean, it could be a psychotic break for people because they don't know, they're like, but no, I really had this experience with the spirit or God, and no one else is going to be able to understand that.
Exactly. And you know, I haven't had that experience, and I've said that, you know, and that's another area where I will just get extra supervision, but I do think it's a big issue.
And it's going to grow.
It's a growing issue.
Yeah.
Thank you. So we need someone to give us a talk about how to deal with it.
Ayahuasca.
Well,
So-
that whole LSD drug.
So part of my motivation, as I said, was to tell you what I offer, but I mean, I can only do so much. But to just pass on a model that's worked, and if it's of any use to anybody else, then speak to me further. And that's it. It's over to the next.
So much.